Hey guys, welcome to part 2 of the facial muscles lesson. We are going to pick up with where we left off by talking about the muscles of mastication, that is, the muscles that are responsible for chewing. Mastication is chewing. And so the first muscle that I would like to bring to your attention is the masseter muscle. The masseter muscle originates right here on your zygomatic arch. Insertion is down here on the angle of the jaw, and so when insertion is pulled towards origin, what this does is it closes the jaw, it elevates the mandible. So let's write that out. This is the masseter muscle, and it is responsible for elevating the mandible, or closing the jaw, closing the mouth. And so when you take a big bite, that is the masseter pulling your mandible up towards your zygomatic arch. Also note that the masseter is deep to the risorius, which is over here, and it is superficial to the buccinator muscle or buccinator muscle over here. The next of 3 mastication muscles that I'd like to point out to you today is the temporalis. And as the name suggests, the temporalis is in the temporal region. Here is the big origin, right here. If we take a look at just the skull, here is the big origin. It all converges down on this one little insertion point right here on the mandible. And so when insertion is pulled towards origin, once again, we get this elevation of the jaw. Right? So this here is the temporalis muscle. It is responsible for both elevating the mandible and retracting the mandible. And so elevating is closing, it is lifting the jaw, pulling your 2 sets of teeth together, and retracting is pulling your jaw back. So this, pulling back under your top teeth. The final muscles of mastication are collectively called the pterygoid muscles. So there are multiple pterygoid muscles. This name may sound familiar because on the sphenoid bone here, we have pterygoid process, pterygoid process. And so those are actually going to be the origins of all of the pterygoid muscles. And so just for some context, these pterygoid processes are kind of flanking either side of the opening between your nasal cavity and your oral cavities and your throat or your pharynx. And so we can look at this in a couple different ways. Here we're seeing a left lateral view of the skull, and the zygomatic arch has been removed and a lot of the mandible has been removed. And we can see that there is this little pterygoid process right here, part of the sphenoid bone, that is deep within the skull. And so these muscles, pterygoid muscles, originate on the pterygoid processes, and they're going to insert in various places of the mandible. And so again, when insertion is pulled towards origin, there are going to be a couple different actions that are going to occur. All right, so let me go back and show you from a different perspective where these pterygoids are. Taking a frontal section through the skull, so here's where the brain is, here's your oral cavity, here is a pterygoid, and here is a pterygoid. And now we can really start to see that an origin over here on the pterygoid process, insertion way down here on the mandible, and insertion pulls towards origin. It's going to move that mandible around. Okay, we can also see that there are other pterygoids that insert over here closer to the mandibular condyle, and so they would be pulling in this direction. So there are several different pterygoid muscles, but for our purposes, we only really need to talk about them collectively as a whole. And so the actions that you should be familiar with are the pterygoids protract the mandible. Right, so our last muscle, the temporalis, retracted, it pulled the jaw back. Pterygoid muscles protract, they push it forward like this. So pterygoid and temporalis pulls it back. Okay, I know that looks silly. Pterygoids are also responsible for depressing the mandible. Okay, so helping to pull the mandible down or open the mouth. And finally, they are able to move or I guess we'll say laterally shift the mandible. Okay, so you can go like this. Right, so moving your mandible to either side, that is also the pterygoid muscles, depending on which ones are active. Okay, so there are three muscles of mastication. We have the masseter, we have the temporalis, and we have the pterygoid muscles.
With a normal swallow, food and liquids move from the mouth into the esophagus directed by a precise sequence of coordinated muscle movements. In order to adequately describe the biomechanics and bolus movement during swallow, the four-stage model was developed. Let's slow down the animation in order to more clearly appreciate what happens during normal swallow. The four stages are as follows: oral preparatory stage, oral transit stage, pharyngeal stage, esophageal stage. During the oral preparatory stage, food is kept in the front part of the mouth where it is moistened with saliva and chewed into a softer consistency. Once the food bolus has been processed by the mouth, the oral transit stage begins with the tongue raising up against the hard palate while the back of the tongue drops to allow the bolus to move into the back of the mouth. Simultaneously, the soft palate raises up against the back while closing off the passageway into the nose, preventing any food or liquids from regurgitating back up into the nose. The pharyngeal stage is a rapid sequential activity during which the bolus is propelled into the esophagus. The larynx elevates while the epiglottis flips down, protecting the airway. Not clearly.
So you might be wondering why I'm showing you this. Our next group of muscles is called the muscles of swallowing. And so you can see that the reflex of swallowing really is a complicated process. It involves lots of different muscles, but the ones that we are specifically going to talk about are the muscles that elevate the larynx. So we can see here, this is the larynx. Lots of special shapes cartilages at the top of the trachea, which has lots of C-shaped cartilaginous discs. You can feel those rings of cartilage as you feel your throat here. So the larynx must be elevated in order to kind of get your airways out of the way. So the bolus of food, right, what you just took a bite of, what you just chewed and worked into a big ball, it needs to be pushed to the back and of course down your esophagus here. And so lifting the larynx is a really important of essentially not letting food go down the wrong tube. So the muscles of swallowing. There are the first one actually is one that we've seen before in part one. And that muscle is this one right here. If you remember, this is called the digastric. So there are two bellies of this muscle, the digastric. And the digastric is important in depressing the mandible as well. Okay? So that part of the swallowing reflex. Next, we have the sternohyoid. The sternohyoid is essentially connected to both the sternum and the hyoid muscle. So if the goal is to move the larynx around, a muscle that attaches to both the sternum and the hyoid is very capable of doing so. So let's add this in. Sterno, so the sternum, this muscle actually originates on the sternum and goes all the way up to the hyoid bone. Okay, so here, this is the sternohyoid muscle. Remember that this here is the larynx, and so the hyoid bone is all the way at the top. And so again, this muscle, the sternohyoid, originates down here on the sternum, and so it can pull the hyoid down and therefore move the larynx for the process of swallowing and, of course, returning back to its original configuration. So the sternohyoid is responsible for depressing the larynx via moving the hyoid bone. Next. And the next muscle is the omohyoid, and that one's pretty much just right next door. Right, this one right here, just kind of sort of see it peeking out. This one is called the omohyoid muscle. And the omohyoid muscle is responsible for both pressing and retracting both the hyoid and the larynx. Right? Of course, these are all moving the entire larynx by moving the hyoid bone. Okay. Our next muscle is actually a little bit deeper muscle. And so in this image, a few more muscles have been removed so that we can actually see kind of what's going on here. So our next muscle is called the thiohyoid. And so I want to point out that this big cartilage here is called the thyroid cartilage, okay, because it's kind of in roughly the same shape as the thyroid gland, which is actually right underneath of it. So this is called the thyroid cartilage. You'll learn more about that in AP2. But it matters now because a muscle that is called the, let's see where to put this, a muscle that's called the thyrohyoid tells us exactly where it originates and where it inserts. And so a thiohyoid is going to originate on the thyroid cartilage and then extend up to the hyoid bone. And so this muscle is right here, originates on the thyroid gland, extends all the way up to the hyoid bone. So this is the thyrohyoid muscle. And so this one is responsible for depressing the hyoid. And finally, last muscle that we are going to discuss here is the sternohyoid. So as you might imagine, this muscle is going to extend or is going to originate on the sternum. Right? And we can't really see it, but it's behind the sternocleidomastoid here and extend all the way up to insert on the hyoid bone up here. Okay, so this is where it would be. And so this is also depressing the hyoid bone. And by extension, the entire larynx. Okay, so those are the last muscles that we are going to take a look at here. Oh, well, yeah, never mind. Moving on. We have 3 head muscle models in the lab, and so I just wanted to quickly walk you through some of the muscles on these models. As you can see, I have outlined the models so that we can label just the outlines, but then you can actually see where they fit in on the models themselves. Right? So I've highlighted the different models. Okay. So let's take a look here. First of all, this muscle here that's around the eye is called the orbicularis oculi. And so that is a one that gets kind of confused all the time. It's the orbicularis oculi. Orbicularis oris, on the other hand, is going around the mouth. So definitely take care to note which one you're talking about. So orbicularis oris, oral, going around the mouth. Orbicularis oculi, going around the ocular, around the eye socket. Okay. Next, we have the masseter. Masseter, one of those muscles of mastication. We have the risorius. And the risorius is here, that fake smile muscle. Okay. We have a couple muscles that are going to originate up here on the zygomatic bone. Okay, so we have the zygomaticus minor, and we have the zygomaticus, where are we? Zygomaticus major. And so minor is generally a little bit more medial. So this muscle right here is minor, and major is this muscle over here. Change the color because it's going to start getting a little bit crowded here. This muscle is responsible for elevating the upper lip. So this one is the levator labii superioris. Right? It literally elevates the lip of the superior side of the mouth. Okay. On the other side, right, so kind of the antagonist muscle here, this is the depressor, right? It's going to depress. What is it depressing? The labii. Which one? Inferioris. Depressor labii. Actually, I used the wrong one, so pardon me for that one. Antagonist muscle to the levator labii superioris is the depressor labii inferioris. Okay, so this one is going to pull the lip down. And so I made the mistake. This muscle here we can see is kind of attaching to the corner of the mouth. And so this muscle is called the, not the depressor of the lip, but the depressor of the anguli of the mouth. It's a corner of the mouth. And finally, the mentalis muscle. This one is right here in the mental region. That's the one that crinkles the skin of your chin and it helps you to, do a really big pouty face. Okay. This muscle, we can see that there are actually two different bellies. So once again, this is our digastric. Okay. Our favorite, our sternocleidomastoid muscle is right here, and of course is really big. It has these two different origins over here, both the sternum and the cleido, right, the clavicle. Okay. Next, these new muscles that I just taught you about a few moments ago. This one, which is a little bit more anterior, this one is called the sternohyoid, whereas the more lateral muscle is called the omohyoid muscle. A little bit more lateral over here. And I believe that that is all of them that we can see from this perspective. And so now that we have all of these labeled, I want to quickly show you that this is what it looks like on the model. Okay, so maybe take a screenshot or maybe pause the video so that you can actually see which one is where. Okay. Moving on to the next model. Again, we'll label the diagram and then we'll take a look at what it looks like on the model itself. All right, we're going to start way up here and we're going to start with the occipito. So origin way back here in the occipital bone, frontalis. So it goes all the way to insert on the skin right in front of your frontal bone, right under your eyebrows. Occipito frontalis. We also have the corrugator supercilii. Corrugator supercilii. And that one is the one that's responsible for crinkling your eyebrows together, the scowl muscle. This one we looked at on the last model. This is orbicularis, and so it orbits around. It's a circular muscle, but what is it orbiting around? It is orbiting around your oculi, ocular, something binoculars. Again, as opposed to orbicularis oris. Oops, it would help if I actually were typing orbicularis oris. Okay, so that one orbits around your mouth, right? The O muscle. Here we have a muscle that is in your chin, so the mentalis muscle. In the mental region. Here we can see a muscle that is, essentially pulling down on the lower lip. And so this is the depressor. It's depressing. What is it depressing? The labii, the lip. Which one? The inferior lip muscle, or the inferior lip. The next muscle is responsible for depressing the angle of the mouth, so true frowny muscle here. So depressor anguli, it's not pulling down a lip, it's pulling down the angle of the mouth. That is this one right here. Note that it has been cut so that you can see some deeper muscles. All right, next we have this muscle, which we've seen a couple times already in this video. This one is called the digastric because there are two bellies. And they pass through this little trochlea here. Some new muscles that we just learned about a few minutes ago in this video. First of all, we have a muscle that it attaches both to the thyroid cartilage and to the hyoid bone. And so we call this muscle the thyrohyoid muscle. Okay. We have a muscle that is attaching to the thyroid cartilage and all the way down here to the sternum. And so I want to point out that both of these muscles are deep to another muscle here. This muscle has been cut off, so both of these thyroid muscles are deep. And so this one is called the sternothyroid muscle. Sternothyroid, going from the sternum all the way up to the thyroid cartilage, not the thyroid, the actual gland. All right, actually a new muscle that I want to point out for the very first time, we couldn't really see it on any of the others before, and that is, change the color so you know it's something different. These three muscles right here. Okay, 1, 2, and 3, three different muscles. These are collectively called the scalenes. And so these aren't muscles that you're going to need to know for the lecture, because none of our lecture diagrams really talked about them or were able to show them, but the scalenes are important for the lab. And so they are going to be deep, or kind of like peeking out from underneath another muscle that we talked about a long time ago, and that is the trapezius. Maybe not that long ago at this point. Feels like a long time ago. There you go, the trapezius, which is this one over here. Right. Next, we have this entire group of muscles right here. Let me point out that on this model, most of the mandible has been removed, and also the zygomatic arch or cheekbone has been removed. And so these muscles are really deep. In fact, they're the first time that we've really seen them from this perspective. So I want to point out that these muscles are the pterygoid muscles. Okay, so they are deep. You can only see them on the right side of this model. This big muscle here is the temporalis. Okay, we can see it. Change the color again. We can see this muscle on the temporal bone, and it all converges down to insert on the mandible, which of course in this case has been removed. And so those are the muscles on the model itself. Let's take a look at what it looks like on the diagram on the model itself here. So here we can see occipital frontalis, corrugator supercilii, etc. But what I really want to point out are these muscles, the pterygoid muscles. They can only be seen on the right side because all sorts of other muscles have been removed. Also, this is what those three scalenes look like. We don't have to learn the actions, but you should know that is what the scalenes look like. All right, one more model for you, and that is this one right here. It's the smaller of the two head muscle models. We'll start at the top as usual, occipitofrontalis muscle. On this model, it's only on the right side of the head. The other side of the head, it has been removed so that you can actually see the skull. Here we have the orbicularis. And what does it orbit around? It orbits around the oculi, as opposed to the orbicularis oris. And so the orbicularis oris is this, this muscle right here orbits around the mouth. A muscle of the chin, or pair of muscles in the chin, mentalis. These little guys here, they're always shown to be cut off because they insert into the skin of the chin. So that is the mentalis muscles. The muscle that is pulling down on the lower lip, depressor labii inferioris, as opposed to this one, which is coming up at kind of an angle. We can see that it is inserting on the corner of the mouth. We have the depressor anguli oris. This right here, and again, it goes more to the corner of the mouth. A muscle that we haven't seen in a little bit because it's so superficial, and so it's often removed from a lot of these models so we can see what's deeper. This is called the risorius. It's a fake smile muscle. And it is just superficial to the buccinator or the buccinator muscle. So the buccinator, I tried to make it a little bit shadowed here. This and this are deeper. So they're the buccinator and buccinator muscles. Right over, also over the buccinator or buccinator muscle is the mentalis, or no, sorry, not the mentalis. Also starts with an S, the masseter muscle, because it is a very strong muscle of mastication. Okay, another really strong muscle of mastication is this one over here, the temporalis. Right, both of which are acting on elevating the mandible. Finally, up here of the facial muscles, we have zygomaticus minor and zygomaticus major. Minor is always on the medial side here. So that one's minor, and this one is major. We can see that both of them are originating here on the zygomatic bone. The sternocleidomastoid, we can see is, or it has an origin way over here on the sternum, here an origin on the clavicle, and it is going to go all the way up to the mastoid process. Remember that that's the big bump right here behind your ear. So this is therefore the sternocleidomastoid. On this model, the hyoid muscles look a little bit weird, so let me take a moment to point those out. The omohyoid, and the sternohyoid muscles are visible in this model. So we have the omohyoid, which is here. This is the omohyoid, whereas the sternohyoid, again, it looks a little bit different on this model than it did on the others. We can see it just barely peeking out there. Okay, so I believe those are all of the muscles that we need on this model. So here's what it looks like on the diagram. Maybe that's what you are following along with. And here it is on the muscle model itself. Okay, so again, these are all more superficial muscles. We can see a little bit deeper buccinator, deep to the risorius, deep to the masseter. Right, the sternohyoid and omohyoid look a little bit different, but they're in the same place. So we can get the idea there. All right. right, so let me clear this, and I believe that that is the end of our lesson here together. So thank you guys so much for watching, and I hope that this helped to learn the muscles of the face. Thank you.